We're going to begin with this. President Biden is preparing to mark 100 days in office this week with a variety of events, including his first speech to a joint session of Congress and a drive-in rally in Georgia. A new CBS News poll finds 65% of Americans approve of how he's handling this pandemic. The president set several goals when he entered the White House, including requiring masks where he is legally able to, like at federal buildings and during interstate travel. While masks are still required in those areas, some states have taken a very different approach. In fact, at least 13 states have lifted their mask mandate orders. Only 26 states now require you to wear a mask in public.
The president also set an initial goal of 100 million vaccine doses administered in his first 100 days in office before increasing that goal to 200 million, and that number was achieved last week. We are now at nearly 229 million doses administered.
As for who has gotten at least one dose, 64% are white, 12% are Hispanic, more than 8% are black, and more than 5% are Asian. And a new CBS News poll finds 22% of Americans say they will not get the vaccine at all. New data from the Kaiser Foundation suggests vaccine supply will likely outweigh demand in the coming weeks.
Dr. Ashish Jha, the dean of Brown University School of Public Health, joins us now. Dr. Jha, good morning to you.
Good morning. Thanks for having me back.
We always appreciate you being on. We have a new survey out, a new poll from CBS showing that about a fifth to a quarter of Americans say they will not get a vaccine of any kind. That is a big improvement, in fact, from February. The number is getting smaller. Is it small enough?
Yeah, I think it will get smaller yet, I'm hopeful. And part of it is a lot of those people, I think, are still waiting and seeing. And if that number diminishes further, then it will be good enough. We don't need to have every American vaccinated, but we do need to have most. And I hope most Americans decide this is really a safe and effective vaccine that is good for them and it's good for their families.
Yeah, we've also learned from the CDC that about 5 million Americans have not returned to get their second vaccination, so one of the Moderna or Pfizer shots. Is one shot good enough? Does that provide any protection for people?
Yeah, one shot is definitely not good enough. It's very, very clear from the data that people need both shots. And so what I say to people is if you miss your second shot, don't worry about it. Go back and get it now. There's no problem in having it been delayed a little bit, but it is critical that everybody get their second shot because that's the only way we know that it's going to really protect you for any extended period of time.
Dr. Jha, you wrote in an op-ed recently that the U.S. has strategic interests to help India manage the coronavirus crisis there, which is escalating in alarming proportions right now. What more should the U.S. do, do you think?
Yeah, I think the U.S. can do a lot, and even since I've written that op-ed, the president and the federal government has come out in strong support of acting. I think it's fabulous. We should be helping them with their hospital supplies, with testing, and also helping them ramp up vaccinations. You know, we have so many vaccines right now that I think we should be sending excess supply, especially of vaccines that we're not using here, to India to help India out at this moment.
You know, I think it's important to emphasize how important it is to help other countries. When the coronavirus first started, we were told if you haven't been to China, don't know anybody who's come from China, you don't really need to worry about it. And we see how quickly this has spread. So I think it's important to emphasize what happens in other parts of the world really does affect us eventually, don't you think?
Yeah, absolutely. This is a global pandemic. We know, for instance, that when you see new variants arise anywhere, it ends up on our shores very quickly. We are really all in this together. And if we're going to get through this pandemic, we've all got to help each other bring the pandemic under control.
The CDC says they're thinking about adjusting the guidelines for masks, that we may not have to wear them outside. Where do you stand on that? Do you think it's time to rethink how and where and when we wear our mask?
You know, absolutely, Gayle. We have learned over the last year that there's relatively little spread outdoors, especially if you're not packed together in large groups. So I expect the CDC to come out with new guidance on this, and I expect a lot of states to begin to peel back outdoor mask mandates. I think that's probably pretty reasonable. We got to keep indoor mask mandates in for a little bit longer. That is where most of the spread is happening, but pulling back on outdoor stuff does seem pretty reasonable at this moment.
All right, Dr. Jha. And the other thing in the near future is the fall start of school once again. Do you expect children to be available for vaccinations at that point?
Well, first of all, I think all kids should be back in school this fall, and I think they will be. Teachers have all been vaccinated. Schools are really a safe place for kids to go back. I expect older kids to be vaccinated by the fall. I think young kids under 12, probably not, but I don't think that should slow us down at all from getting everybody back in school this fall.
All right. Well, the possibility of not having to wear a mask outdoors during the summer and not getting a mask tan, I like that possibility. Dr. Ashish Jha, thank you very much. We appreciate it.
Thank you.